Arthritis is a painful and often life-altering condition that affects millions of people around the world. Managing arthritis usually involves medication to control pain and inflammation. However, some drug combinations can actually make your arthritis worse, increase side effects, or cause dangerous complications. In this video, we'll talk about 6 drug combos that you must avoid or take extreme caution with if you suffer from arthritis. Let's begin. Number 1. NSAIDs plus corticosteroids. NSAIDs, or non-steroidal anti-inflammatory drugs, include medications like ibuprofen, naproxen, and diclofenac. They're commonly used to reduce inflammation and relieve arthritis pain. Corticosteroids like prednisone are also used to control inflammation in severe cases. Taking NSAIDs and corticosteroids together might seem like a powerful combination for reducing pain, but this combo can do more harm than good. When used together, they significantly increase the risk of gastrointestinal bleeding, stomach ulcers, and even perforations in the digestive tract. Both drug types irritate the stomach lining, and when combined, the irritation can become severe. Additionally, they can both impact your immune system. Long-term use can weaken bones, increase blood pressure, and lead to other complications like fluid retention and weight gain. If you're using both these drugs at the same time, make sure your doctor is closely monitoring your condition. Using a protective medication like a proton pump inhibitor, such as omeprazole, might help reduce stomach damage. Number 2. NSAIDs plus blood pressure medications like ACE inhibitors or diuretics. Many arthritis patients are older adults, and it's common for them to also have high blood pressure. NSAIDs, when taken with medications that treat blood pressure, especially ACE inhibitors or diuretics, can interfere with how those drugs work. This combination is known as the triple whammy when NSAIDs are used with ACE inhibitors and diuretics together. The danger here is that this trio can cause serious damage to the kidneys. The risk increases especially in people who are already dehydrated or have existing kidney problems. NSAIDs can reduce blood flow to the kidneys, while ACE inhibitors and diuretics already affect how the kidneys function. When all are used together, the kidneys can be overwhelmed and fail to filter waste properly. If you must take NSAIDs while on blood pressure medication, talk to your doctor. Regular kidney function tests, checking your creatinine and potassium levels, are essential. Also, keep yourself well hydrated and avoid over-the-counter NSAIDs unless advised by a professional. Number 3. Methotrexate plus sulfa drugs like Bactrim. Methotrexate is a disease-modifying anti-rheumatic drug, DMARD, often prescribed to slow down arthritis progression. Bactrim is a common antibiotic used to treat infections, and it belongs to a class called sulfa drugs. Combining methotrexate and Bactrim can be dangerous and even life-threatening in some cases. This combination increases methotrexate toxicity in the body, leading to side effects like severe bone marrow suppression, mouth sores, low white blood cell counts, and liver damage. Both drugs affect folate metabolism in the body. When taken together, they can severely reduce the body's ability to produce new blood cells, making you more vulnerable to infections and anemia. If you are prescribed an antibiotic while on methotrexate, always inform your doctor. Avoid sulfa-containing antibiotics unless there are no alternatives and your physician has weighed the risks and benefits. 4. Methotrexate plus NSAIDs. You might think combining methotrexate and NSAIDs is fine, since both are commonly used in arthritis treatment. However, this combination must be used cautiously. Methotrexate is cleared from the body through the kidneys. NSAIDs can interfere with this process, especially when taken in high doses or for a long time. When methotrexate isn't cleared properly, it can build up in the body and become toxic. This can lead to symptoms like nausea, fatigue, liver inflammation, and low blood counts. In severe cases, it can cause serious complications that may require hospitalization. Doctors sometimes prescribe both drugs together, but only under close monitoring. If you're on methotrexate, avoid self-medicating with NSAIDs like ibuprofen or naproxen. Always check with your doctor or pharmacist before taking any over-the-counter painkillers. 5. Biologics like Humira plus live vaccines. Biologic drugs like Humira, Enbrel, and Remicade are powerful treatments for autoimmune arthritis. They work by suppressing the immune system, helping to reduce inflammation and joint damage. However, this immune suppression comes with a serious warning. Do not take live vaccines while on biologics. Live vaccines, such as the MMR, measles, mumps, rubella, yellow fever, or the intranasal flu vaccine, contain weakened forms of viruses. In healthy people, these vaccines are safe and effective. But for someone on biologics, the immune system may not be strong enough to handle even a weakened virus. This can lead to a serious infection. Before starting any biologic treatment, make sure you are up to date with all your vaccines. Avoid live vaccines while on biologics, and talk to your doctor about safe alternatives like inactivated or recombinant vaccines. 6. Corticosteroids plus anticoagulants, like warfarin. Corticosteroids help reduce inflammation and are commonly used in moderate to severe arthritis. Warfarin is a blood thinner used to prevent blood clots in people with heart conditions or clotting disorders. When taken together, corticosteroids and warfarin can increase the risk of bleeding. Corticosteroids can irritate the stomach lining and may lead to ulcers or small tears in the digestive tract, which can bleed. When you add warfarin into the mix, even minor internal bleeding can become dangerous. This combination also complicates blood monitoring. Warfarin requires careful dosing and regular blood tests to monitor your INR, a measure of how long your blood takes to clot. Corticosteroids can interfere with this balance, making it harder to keep blood levels stable. If you need both medications, regular INR testing is essential. Your doctor may also recommend protective medications to reduce the risk of stomach bleeding. Final thoughts. Managing arthritis often requires using several medications to control inflammation, ease pain, and protect the joints. But as we've seen, some drug combinations can create serious health risks and may even worsen your arthritis or overall health. Let's quickly recap the 6 dangerous combinations. 1. NSAIDs plus corticosteroids increases risk of stomach ulcers and bleeding. 2. NSAIDs plus blood pressure medications can lead to kidney damage. 3. Methotrexate plus sulfa drugs causes methotrexate toxicity. 4. Methotrexate plus NSAIDs increases risk of methotrexate buildup and side effects. 5. Biologics plus live vaccines raises the risk of severe infections. 6. Corticosteroids plus warfarin raises bleeding risk and complicates INR control. Always inform your doctor about every medication you're taking, including over-the-counter drugs and supplements. Never mix medications without medical supervision, and always ask about possible interactions when starting a new drug. With the right knowledge and precautions, you can avoid dangerous combinations and take better control of your arthritis treatment. If you found this information helpful, please like, share, and subscribe for more videos on natural health, arthritis tips, and medication safety. Take care and stay healthy.